This is the found in operating rooms. In addition, and will arrive we knew that it would take months to design, permit, and fabricate. In the meantime, during our latest shutdown, we decommissioned the air handler that was working at the time, switched to a secondary system and enhanced that system. We instituted regular air testing and worked with our local experts to define criteria to reopen our operating rooms. Based on the information that we had at the time, we opened our operating rooms in July, since we believed it was safe to resume care and performing surgeries while implementing our plan and our ongoing monitoring. Since opening the operating rooms on July 4th, we had performed over 3,000 surgeries and continued to do our regular and frequent air quality testing. The air tests were reassuring that we continued to be safe. Clearly, this latest infection that we discovered last week proved that we must go to a higher standard, and we have to do it now. I have made the decision to temporarily close most of our operating rooms until the end of January to complete these comprehensive improvements. These ORs will remain closed until these enhancements are fully in place. The temporary closure of most of our operating rooms will allow us to accelerate our improvements in the most efficient way. We are continuing to engage with our external experts to make sure that we are doing everything possible for the safety of our care. And we're doing more than just making improvements in our air handling system. We continue to work on our rigorous environmental standards, continue to deploy our robotic ultraviolet cleaning system, and we will continuously identify and implement improvements in our systems. We also continue to partner with our local hospitals and health systems to make sure that we can provide surgical care for our patients when they need it. We will conduct a rigorous and thorough review of all of the factors that led to this situation, and we will continue to make changes, including our culture, our leadership, and our systems, specifically how our high reliability systems of these every day to do the right thing for our patients and families. We take care of the sickest, most complex kids. We have a critical role in our community, and we take this responsibility incredibly seriously. We never take our community's trust for granted. In challenging times like this, we will come together, commit to get this right, and remember why we always do this, for our patients and for our families. I'm incredibly grateful for our patients and families for working with us during this period. I'm grateful for our team for being resilient and staying focused on our mission. I'm grateful to our hospital partners who have helped us through this, specifically Harborview, Swedish, UW Medical Center, Mary Bridge, for helping us deliver care for our kids. And I'm grateful for our community for sticking with us while we get this right. We will do everything in our power to get this right. And we will not stop until we do. That's what our community expects. Most importantly, that's what our kids deserve. And as we talk about technicalities and technical systems and micron levels of Aspergillus, as a pediatrician, for me, what we could do. Their simple answer was work hard so other families don't have to go through this. And we have worked hard, but we have not gotten it right. And I promise to that family and all of our impacted families that we will continue to work hard. We will get this right. It is what our kids need. It's what they expect. Now I'll take questions. And
I have a question for you. I want to ask about the reactive media statement. Doesn't that document that was drawn up in July 2018 just show a plan to cover up this mold problem?
You know, our focus through all of this obviously was with the best information that we had, make the right decision for our kids, improve our systems, and then continuously make sure that we're looking at what we can do to make that better.
But why not be transparent? That listed questions that your people should only answer if asked, critical questions. Why have that document? Why have that plan?
We are here today. We've talked about this. We have been open and transparent with this condition. We wanted to share this information of previous infections because our focus right now is to get this right, get our systems better, move forward, because for all very complex children who have gone through these surgeries. We know these families. We continue to follow these families. So we have been supporting them directly, both in our care, the clinical teams who know these families and care for them, our family support services that follow them. And again, we want to make sure that they have everything that they need as they go through this. So the care, again, is obviously everything from what clinical care they need, what follow-up they need, and then with our family support teams, what additional support that we can give them as they go through this.
Would you allow your child to have surgery here? Would you allow your child to have surgery here?
I completely believe in this team. I believe in this organization. I would allow my child to have surgery here.
All right, we had a question from
How many patients in total do you think have been potentially exposed, and how many have you confirmed come down with the illness?
So what we've described today, so we have had 7 2014, 7 additional patients during that time that have been impacted. Those are the patients that have been impacted by this. Again, for perspective, during that time, we would have performed more than 200,000 surgeries. But those are the patients that we know have been impacted, and they continue to fall in a very small category of the most complex, most complicated children that we take care of.
Can you describe the culture here, outside from the patients, how your doctors and staff are feeling? Is that having an impact in that?
We are all devastated by this. You know, I think, again, as a pediatrician, you know, and as I talk to my colleagues, our team comes here every day because they want to do the right things for kids. They want to take care of kids. When they can't do that because we have had these issues, during the first parts of the dig, typically you see this more in vascular.
Why
They deserve that privacy. You know, it's easy to say it's the law. For me, it's more important. It is the right thing to do, and it's what they deserve. And I will not compromise on that. And so that's what we have fought to protect.
And we have one final question over here.
Thank you, Doctor. Why are we seeing this at Children's and not at other local hospitals? Do you have different protocols here that play a factor in that?
You know, for us, obviously, we know that Aspergillus is everywhere in the environment. And I appreciate how many of you have reported that. So we probably all breathed Aspergillus as we walked into the hospital this morning in the outside air. What we know is that Aspergillus is impossible to eliminate from a hospital setting. So our job is to make sure that we are doing everything we can with our systems to eliminate exposure to patients who are most at risk. We can certainly speculate around our kids, obviously, because of their complexity and things. The other part, of course, is we don't know what happens at other hospitals or what rates of infections. The thing I'm accountable to, the thing that we are accountable to, is what happens here at Children's. And we have had too many of these infections. And so that's why my sole focus, what we are working on, is to make sure that we do everything we can to eliminate the exposure to that.
So then when was the new air system that's coming here by January 4th? Did we do that all the way back in July 2018?
We did that actually in May of 2019. So immediately when we realized this May, when we had 3 new surgical site infections from air handling units. The decision to explore how we could put these in-room HEPA filtration systems into the ceilings of our operating rooms. That is not something that is done in most hospitals or health systems. We were in the process of doing that. We have 3 of our rooms that have that system in place. The decision that I have made now, given this latest infection and knowing we have to get to a higher standard, so we had to make a difficult decision. I absolutely believe it's the right decision in the safety of our patients. It will cause significant disruptions to our patients, like we experienced in the spring and summer, where we will have to delay a number of cases. Obviously, I believe our patients and families believe that will be the right thing to do, but that's why we made the decision to do the closure of most of our operating rooms to get this right.
Thank you, Dr. A few follow-up items for you all. We have a written statement attributed to Dr. Sperring that we'll hand to you on your way out. Additionally, we're providing a timeline of Aspergillus infections at Seattle Children's for you as well. So thank you all for being here today.